and I'll be moderating today's session. So before we get going, I just want to say this is one of those topics where I think the conversation is really catching up to reality. And so we've been talking a lot about AI in healthcare for years, but what's happening right now in health plans is generally different. It's not about pilots, it's not about proof of concepts, it's not about just trying things out anymore. It's really about operational transformation at scale. And the organizations that figure that out are the ones that are going to be looking very different from the ones that don't. And so that's exactly where we're going to dig in here today. And so today we're going to cover four topics. One is why AI has become a strategic imperative, where it's creating real impact right now, and what it takes to scale, and then also where agentic AI is taking us next. So if we move on to the next slide, I'm going to introduce our panelists. So our first panelist leads digital health globally at AWS. He spent his career helping health plans, providers, and governments turn data into action. So basically from shaping federal health data infrastructure at NIH and ONC to driving large-scale transformation at places like PwC and Guidehouse. He sits right now on the National Academy of Medicine's Digital Health Action Collaborative and the ASPPH Task Force for Responsible Use of AI. So the governance and scalability questions we're going to tackle today are the ones that he's actively working through at a national level right now. So I'm going to introduce Dr. Abdul Sheikh. Our second panelist is, oh, sorry, Abdul, go ahead.
No, I was just saying thank you. Appreciate the opportunity to be.
Yeah, thanks for coming. Our second panelist is Chief Innovation Officer at Innovacer. So he co-founded Exploris and also served as Chief Health Information Officer at IBM Watson Health, and also spent years as a physician and senior IT executive at Cleveland Clinic. He was appointed by Congress to the Federal Health IT Advisory Committee under the 21st Century Cures Act. And what makes his perspective relevant today is that he's operated on every side of this spectrum. So he's been a clinician, an informaticist, a technologist. So when we talk about exactly what it takes to scale AI inside a health plan, he's lived it. So welcome, Dr. Anil Jain.
Thank you, Derek. I'm really looking forward to this conversation.
Yeah, thanks for coming. So just one thing for the participants, I just want to call out the surveys. They're going to be on each slide as we walk through these questions. So you'll notice a survey prompt on your screen for each question we cover. So please take a few seconds to respond as we go. What that's going to do is really help us capture real-time perspectives from everyone in the room, make sure we're getting insights that'll help shape our conversation here. So we'll jump right into the first question. So question one, why is AI a strategic imperative right now? So for years, AI was framed as an innovation opportunity, something that health plans, should be tracking. That framing has really shifted. So plans right now are dealing with rising medical costs, growing administrative burdens, new member expectations, and also the regulatory environment in place with CMS 57, 62. Really, those things are actively forcing workflow modernization. So, and at the same time, the emergence of tools like OpenAI, Claude, Copilot really has raised the bar on what's operationally possible. So the question is no longer, should we invest in AI? It's how fast can we do it and how to do it strategically. So for our panelists today, the main question is, what's driving AI from an innovation initiative to true strategic imperative for health plans today? So I'm not sure who wants to jump in first, but Anil or Abdul, feel free to jump in.
Well, I would love to see what the audience thinks before we start our dialogue, if that's all right. If our team can put up some of the results, love to get Abdul and I to sort of react to it, if you're okay with that, Derek.
Yeah, perfect.
Wow. I think very consistent with what we're hearing and what we're seeing out there in the field. I think, you kind of sort of alluded to a few things really, really well, Derek. I think there is really five things at play here, and I think these sort of aspects really capture that well. One is that the what used to be sort of an innovation roadmap is now become a strategic imperative to use AI, right? It's gone into the boardroom at the C-suite level in a profound way, and we're seeing some of that in these survey results. Part of that is because the workforce math doesn't really add up anymore, right? You can't just keep throwing people at things, and you see that in the response around reducing some of that manual workflow. And I think if we think about AI as one of those operational efficiency levers, it's captured very well in this. I think the other part of the story has to be that there's competitive pressures. I know we're going to get into that in a little bit later on, but the clock has started. If you think we're moving very quickly with generative AI, imagine what those conversations in the boardroom that our colleagues on the call are having, the kind of pressures that they're facing. AI is an enabler to start having them think in a more strategic way about addressing some of the barriers that they're confronting when it comes to cost, quality, engagement, risk adjustment, all those things that they're doing on a regular basis. And I know we're going to get into some of that as well. And the good news is that I think the regulatory changes are actually tailwinds in this process, as opposed to what typically happens with regulations, which are headwinds. But I'd love to get Abdul. I don't know if you would agree with that or not, but I see the regulatory
We
side as
do.
more of a tailwind right now.
That's right. Yeah, and these poll results are interesting, right? Because clearly, manual workflows, right? Those inefficiencies, the operational costs, those are key drivers, and they've been there for a while now, right? But they've also been there, I think, since we've seen this real acceleration towards using AI and generative AI in particular over the last couple of years. But the other interesting thing to note, though, is that only 13% of our respondents here pointed to CMS mandates, right? But I think I would read that as probably the people on this call, you're living it, right? You already know that the mandates are here, right? 57F went live on January 1st. 62P extends the same types of push to drug prior auth. And so we're seeing that shift in conversations that me and colleagues are having with payers and with the ecosystem around, should we invest? How do we really get to production in 90 days, right? And that I think touches on the drivers here. What is the low-hanging fruit that you can take advantage of now, knowing that you have those tailwinds, which are CMS mandates?
Yeah. And I'll just add one more thing to what Abdul has just shared and what I shared earlier. I think I would hope that our audience would also agree that we as consumers have higher expectations for our health plans as well. We experience AI in our daily lives in ways that are still trickling into healthcare and health in general with health plans. Why can Netflix tell me what my next favorite show is going to be, but my health plan is still struggling to help me complete a prior auth as a patient or as a physician helping me do those sorts of things? So I think there's a consumer expectation that has also made this go from an operational innovation into a strategic imperative. AI is here. And as you said, Derek, earlier, it's not a question of if, it's a question of, the speed of trust and the speed of value is what's going to drive the AI adoption.
Hmm. Yeah, I think you touched on it there, Dr. Jane, especially around, the urgency around everything, not just one thing, right? Operational efficiency, member experience, financial performance, et cetera. So, I mean, in your all experience, where are you seeing the biggest push in that space? Is it an operational efficiency play? Is it financial performance? Is it member experience?
I
Yeah,
really
I mean,
see.
go ahead, Abdul, please.
Well, from our vantage point, and I imagine you're probably seeing the same thing, the fastest adoption is around prior auth, right? Because regulation has made it non-optional. And so we're seeing secondarily like coding and risk adjustment, right? They're very close behind, and that's creating immediate revenue pressures. I appreciate though that Anil, you mentioned member expectations, right? And member engagement. Because everyone uses ChatGPT, Claude, pick your platform to ask questions about their care, right? And about, how to really understand their care pathways, including how to pay for their care, right? And so that member expectation is shifting, right? And so I think we really need to think about how we can help payers really drive that member expectation evolution. And so this regulatory agency, I think this revenue impact is really important. But what's going to differentiate you as a payer, I think, is also going to be important. And that's this next wave of how to use AI. What do you think?
I completely agree. I would probably bucket this in a way that, at least for me, I can understand this a little bit better, is that when you think about the operational side, it's definitely prior authorization. There is significant workflow improvements. But on the revenue side, it's risk adjustment. That's where the revenue is coming from for these organizations. And if you're fortunate enough to be an organization that can walk and chew gum at the same time, and certainly AWS and Innovacer, when we have clients we work with, that's what we try to help them do, because you got to be able to juggle multiple things and do multiple things at the same time. The member experience is incredibly important for growth. But I think from a revenue point of view, we have to make sure we're applying AI to the risk adjustment and make sure that we're not leaving money on the table, if you will. And the prior authorization is a poster child for operational efficiency. And certainly, I would agree with Abdul. That's if you could only pick one area to start with, it would be on the prior auth utilization management side. If you were thinking about the revenue side, I would start with risk adjustment. That's probably one where there's a little bit more of an understanding. But if it's about workforce and operational efficiency, prior auth, and when we have our meetings as Innovacer in the C-suite, that's what we're hearing from our clients as well.
Yeah, perfect. Thank you for the context there. Kind of shifting gears a little bit in terms of looking at competitive pressures. So obviously, more organizations are operationalizing AI at scale. And so, how are health plans starting to view AI maturity as a competitive differentiator? What are you guys seeing out there?
Well, I think the it- appropriately using AI needs to be a muscle that gets actively used. And I think the world of AI is moving very quickly, not just for Innovacer, but I'm sure Abdul would agree for AWS as well when we start putting different things together. So the ability for a health plan to create that AI operationalization muscle would be to form an AI governance process, for example, to make sure that there's an evaluation strategy, a framework, if you will, to evaluate vendors. Thinking about what it means to move from a point solution approach to a platform approach. These are all things that will give them a competitive advantage. Maybe not today. Maybe it might seem to be a burden today. But I always equate the implementation of AI it's not a sprint and it's not a marathon. If it's a marathon, you're going to lose. And if it's a sprint, you're going to lose. But think of it as a relay race where you bring the right team members to the table and you keep passing that baton to the next person and the next person. Think of AWS and Innovacer in many ways as your team members. The competitive advantage comes to knowing how to work well in that environment. It's not just going to be up to the health plan internally to figure all this out. It's the right partners in a relay race where we have a singular goal and we bring multiple partners to the table. That's what I think is the biggest competitive advantage. Derek, if you ask me to predict what AI is going to look like for payers in 3 years, I know we're going to talk about that, but I tell you, we're all going to be wrong. Things are moving so quickly right now. It's more about
Exactly.
getting that process in place.
Yeah, I would agree because competitive pressures, like really, when we look at it, I've seen some numbers show that 75% of payers are committing like more than $10 million, and 37% have deployed across multiple care functions, right? But plans that are still in pilot mode, they're falling behind. And so the competitive pressure isn't about who has that best chatbot, even internally, right? It is looking at the star ratings, the financials, right? The revenue side, as you said, Anil, network adequacy. And so plan that's really thinking holistically about this, right? That's looking at closing care gaps proactively, right? That moving quickly around resolving PA prior auth, right? And personalizing that outreach at scale. That's going to really be a compounding advantage that's hard to catch, right? And that's
Yeah.
where AI maturity, I think, is really becoming a differentiator because it's not just about the efficiencies, right? And we saw that in the survey we just put up. Efficiencies are table stakes and they're low-hanging fruit. You have to do that now. You have to do that yesterday, right? But as you said, Anil, plans are thinking about co-developing, right, with partners like Innovation, right, and AWS, who have that deep healthcare domain expertise. I think they're going to get there faster, right? And that's where we have to really think about moving from pilots to the enterprise.
Yeah, I'll give one anecdote that I think is really, really it's eye-opening. So we were chatting with one payer, C-suite members, where they said they were going to go through a 9-month process to evaluate different AI capabilities and then do a pilot for 6 months. But I'll tell you, in the time scale that we're talking about here, with the advances that we're making, all that needs to be compressed. And we need to be thinking about having a much better path to going from evaluation to, and I'm not even going to use that P word pilot in the same way that we all think of, because pilot purgatory is too real, but then moving it very quickly into confidence building milestones. because I don't think we can afford to do analysis paralysis when it comes to the opportunity for AI to help improve the not only the competitive posture, but really the satisfaction that health plans need to be able to drive into the various stakeholders that they have.
Yeah, so thank you both. Great insight there. We're gonna jump to the next question. So the next one is, where is AI having the most impact? So a lot of organizations have, and you mentioned this, Neil, too, have been experimenting with pilots and different things like that with AI for a while now. But experimentation, operationalization are two totally different things. And so what I'm hearing from clients on the innovation side really is, some use cases are really scaling fast, and others are looking promising that looked promising in pilots are stalling or really not even coming to fruition. So again, reminder to fill out the survey that's on the screen here. But the main question is where are health plans seeing the most tangible, measurable AI impact today? So we'll give just a second for some of these answers to come in, and we can go from there.
This will be interesting to see.
I've got some guesses.
What are your guesses, Derek?
Prior auth and clinical ops.
It's amazing what people are actually doing, though, and I think the survey results about what's actually happening in the field would, to your point, Abdul, would be very interesting for us to react to. All right.
Oh, wow. Did I win?
You get a gold star.
Look at that.
Hopefully I didn't jade the audience.
I think what's, not surprising, but it's comforting to see that member engagement still has a few respondents, because I think that's an important part for all of us because we're all members at some level as well. But I also like the fact that there's a few that might still be evaluating. They're not yet jumping into this. But again, I think if you dovetail where people are with what the question here is, which is where is the most meaningful impact, I think you'll see some synergy there. I think. And I would imagine that if we did this same question 6 months from now, a year from now, we might still see very similar results. But Abdul, what do you think?
Yeah, I like these results because they do map onto what we're seeing, right? The PA, we've said it's the fastest, right? Because regulation has made it non-optional. But coding and risk adjustment are also close behind, right? And so we're seeing that push towards with the updated risk adjustment model to calculate Medicare Advantage capitation rates. I think it's the HCC V28. Member engagement is also important. And I'm glad that's at 31% too. Looking at where we're seeing the next wave of adoption after this first phase, I think that's where we really need to be thinking about. And we said this a few minutes ago, right? That member engagement is earlier in its maturity, but that's the next wave. And you need to really then think about what is your architecture, right? Not just the technical architecture, but like the human in the loop and the government's architecture when you're looking at that engagement piece. So I think overall the pattern is regulatory urgency. It's driving the first movement towards PA, but revenue impact is really driving the next phase, and competitive differentiation is going to probably be part of that member engagement piece.
Yeah, no, Derek, I'll just add that it may not be in scope of this particular question, but whenever we think about AI impact, one of the challenges, and I just got off a call this earlier today, one of the challenges is that you really can't do meaningful AI intervention on business imperatives if you haven't really set the foundational data and platform in the appropriate way. So I would just say that, and for all of the folks on the call, that if you are really serious about AI and making the most meaningful impact, make sure that you have a good underlayment when it comes to the data infrastructure. Otherwise, I think the impact may not be sustainable, or it might have a lot of operational friction to get there. Whether it's interoperability or sort of thinking about a enterprise data model with a data strategy, all those things about bringing those different silos of data together to drive that AI is an important piece. And I wanted to make sure we didn't lose that insight in the scope of this particular question. that's something that Innovacer feels very strongly about. I know Abdul, AWS and Innovacer together have been really on this bandwagon around the data hygiene that payers need to have in order to do AI successfully. I always say that you can't really have an AI strategy without a data strategy. So I don't know if you have any reactions to that, Abdul, or
Absolutely.
not.
I think we would all agree, right, that interoperability is the single biggest determinant of whether AI can deliver value, right, enterprise value, or it's going to stay stuck in pilot mode, right? And you found it in your survey. We're seeing this in the field, right? Payers' data lives in, 15, 20 or more systems, right? And if AI is not able to get access to that data, but if your process for using AI also can account for potential gaps in the data, right? Structured and unstructured. Does it actually represent the types of constructs that you're trying to capture for the AI to then harness? All of that is part of your data strategy. And I think that's where Innovator has been built on AWS, right? The unified data platform is really good at aggregating those fragmented sources so that AI can deliver on its potential. That's so important.
So I think shifting here a little bit, we talked a lot about regulatory adoption and things like that. Where do you see some of the strongest momentum outside of that right now, right? And then just to add, why are some of those areas becoming the initial proving grounds for adoption within payer orgs? So kind of to reiterate that question, which areas are we seeing the fastest adoption outside of regulatory necessity?
I think at the end of the day, health plans have to have a fiduciary responsibility. And they're going to look for areas in which there may be low value work being done by very, very expensive resources, human resources. And so any opportunity to go in and identify those workflows that can be made more efficient through responsible use of AI, they're going to do. And if they're not going to do it, a year, 2 years from now, they'll look back and say, we did not live up to the principles and the requirements and responsibilities we had to our employees, our shareholders, and our members. And so I think those are exercises that are happening. We're hearing in the C-suite. Some we're helping our clients out with. Sometimes they're coming to us after those exercises have been done. But there it does need to be that exercise where you look across your enterprise and look for those opportunities, and then think about what a platform approach versus a point solution might help you do in an accelerated way.
Right. And we're seeing this play out at the board level, which is important, right? That these discussions around AI are really requiring that input and that approach to governance because you're redesigning workflows, right? The fundamental workflows, right? Administrative and member engagement and financial. When you're any kind of organizational transformation, that's what AI represents, right? It's not just on the technical suite, and that's what we know. I think particularly with agentic AI, the way that I like to describe them is they're digital colleagues that you're thinking about integrating into your workforce. What does that even mean? Right? It's a whole new type of worker support, essentially.
Yeah, I would just add it's digital colleagues that we actually enjoy working with, as a caveat. And at some point, these digital colleagues will have their performance reviews. They'll either be promoted or retained or not. And so I love that point, Abdul, because I think that's an important distinction that we have to think about working alongside, not having them replace, but working alongside. That's what is being expected. It's happening in other industries. And we can't be yet again the last to embrace these aspects. Again, all within a responsible AI framework, because that's critical from a respect point
Yeah,
of view.
like the analogy would be like on the clinical side when you had the introduction of PAs, right? Physician
Yeah, yeah,
assistants, administrators. Like,
yeah.
bringing them to the workforce required fundamental restructuring and redesign of care, clinical care workflows. So it's similar with, I think, agentic in any type of organization.
That's right.
All right. So kind of in the same vein here. So if we shift over a little bit to operations, and then also how we're kind of balancing automation and operations with provider and member experience. So, would love your thoughts here. So, number one, where are organizations starting to see the fastest ROI? Like, where are they making how are they getting the fastest ROI from their AI investments? And we know everybody's investing a ton of money here, but where are they getting that ROI first? And then how do you balance that with provider and member experience? So, kind of a two-parter here, but feel free to break them apart or answer them together.
That's a tough one, but Abdul, you want to take a crack at it first? And
Sure. Yeah, and this comes from our team working with payers. And so what we're seeing is that three areas can deliver ROI in the near term, right? Number one, prior auth automation, right? We're seeing that like even like 60% or more of cost reductions with payback. Claims auto adjudication, right? You can process like thousands daily versus taking like 20 minutes per claim manually. And then contact center AI, right? Really looking at those operational cost reductions that are measurable. And I think these three cases, what they share is number one, high volume. Number two, manually, they're very expensive at baseline, right? And number three, they have achievable accuracy bars, right? And so that's where some of that is because of the codified nature of the information in these three task areas is really amenable to AI. And so on the far end, then after that, I think you're looking at pop health and care gap closures and other opportunities. But in the near term, it's those three. What are you seeing, Anil?
yeah, I would agree. I would think about this as different use cases will have a different time horizon for that ROI. Areas in which we might need to start augmenting staff members with those digital colleagues, with those agentic colleagues, there might be a learning curve. It's not you may not get that value immediately, just like bringing on a new employee into your firm. There's a trade-off. And so they're going to have a different time horizon. But the key thing about getting that ROI and making sure it's consistent and explainable to the CFOs and to the operators and to the shareholders and to the employees is to make sure that you actually have the right KPIs established. And I think Abdul said it well that you want there to be a clean way of measuring these things. But sometimes what I see when AI so-called pilots fail, and most of the time they don't fail because of technical issues. What they're failing because of organizational issues. We didn't define the KPIs correctly. We didn't do the apples to apples comparison. We did an apples to oranges comparison, that sort of thing. So I think it's really, really important that all the different projects will have a different time horizon. And the misalignment comes from someone thinking that they're going to get value in a week or two, but realizing that there may need to be some investment in the first few weeks to the first few months to get even greater return on investment beyond that. So it's a complex answer. The good news is that partners like us, we can help you figure that sort of thing out, giving you stories just like the stories that Abdul's sharing around his clients. This is something that we can help with if anyone's trying to understand where to start and where to go next, depending on your organizational makeup.
Yep, exactly. Thank you there. And then a really great question I just seeing out of the chat here, and it kind of really combines well with what we're talking about right now is when it comes to agentic AI, are health plans pursuing more of the inbound use cases? So the audience member that's using agentic AI to answer member and provider questions, or outbound using agentic AI to make outbound calls to conduct HRAs, provide reminders, etc. Any thoughts there?
I, Go ahead, Anil. I'll follow you.
No, I was just going to say it's all the above. Um, it depends on the organization and what investments that they've already made. Many of them are already familiar with the web-based chatbots or the call center IVR, interactive voice response types of systems. And if they've got a good content library, moving from a content library based IVR or a chatbot to an agentic natural language type of approach is probably far simpler, especially for the non-clinical use cases. Whereas those organizations that might be doing it de novo may want to skip the older technologies altogether and jump right into the the inbound types of work. And then the outbound ones, absolutely. For example, nudging for special programs, nudging members who might be eligible for special programs and things of that sort are low-hanging fruit for many organizations.
I was going to answer the same. That I would answer yes, right? And it depends. Depends on the customer, right? Their priorities. We call it working backwards from that need. But the best implementations make this automation invisible, right? And so, a member calls, the agent already has their benefit summary open, right? Care gaps are there. That's AI reducing friction, right? Not adding it. But when you get it wrong, deploying automation creates burden, right? It portals providers where they don't want it. Chatbots can't escalate, right? Or annoy members, right? And so some of the design principles that we see are really important. And I know working with partners like Innovacer, it really is a pleasure because you guys share these, include, thinking about automating the back end complexity, but simplifying that front end interaction, right? Because you have to have these human escalation paths and you have to have transparency, right? Transparency about AI involvement with your members, right? And with the other users. And so I think that's really important. The third thing is you got to measure that experience engagement, right? Or else you're just shifting costs. Because if you're not measuring that engagement and what it's like, the UX, then you're going to have some real issues.
Yeah, I'll share one quick thing that we're seeing on the healthcare provider side that could be very relevant for the health plan. I used to be an internal medicine primary care doctor in the old days. And one of the things I was convinced about was that human doctors would be more empathetic towards their patients than AI agents would be. But several studies have shown that AI agents can actually be more empathetic with patients than human beings can be. So I would make sure that you do not allow for slowing down because you're worried about the reaction from members. I think members will surprise us. If we can get services and questions done faster with empathy, and that's what the data is showing, then let's move. Let's move on it sooner rather than later because the status quo is unacceptable right now.
Yeah, that's a great insight here. Appreciate it. So, and thank you for the questions online as well. So let's jump to question number 3. So what does it take to scale AI with large language models? So as most of us know, the availability of LLMs like GPT, Claude, Copilot really has changed the conversation about what's possible. But health plans are quickly learning, that access to a model and enterprise scale AI are very different things when actually put into practicality. So the question has shifted from which model should we use to what organizational capabilities do we actually need to make this work across all of our complex regulated workflows across the entire health system. So back to the question, what foundational capabilities are most critical for scaling AI successfully across the health plan? And if folks could fill out the survey, that'd be great and help us shape the conversation here a little bit more focused to everybody who's online here. I don't think I'm as confident with my projected answers as I was on poll number 2.
Well, I'm going to guess that it's going to be data, but we'll find out.
That's our bias, certainly.
Yeah. um, I, I didn't think we didn't have energy consumption as one of the answers, but that could be another one that could that could
Very
be
well.
very. No, I was wrong. I was wrong. Not surprised, but wrong.
I appreciate that the lack of a clear strategy and
Yeah.
governance is foremost here, right? Because we've talked about interoperability being table stakes, but I think that challenge to really develop and operationalize AI, generative AI, agentic AI at enterprise scale, I think it does really touch on mature AI governance, right? And one of the ways I've seen that evolve is when you have a chief AI officer role, right? And you want them to have structural accountability reporting to the CEO. You want to have the right cross-functional teams engaged. And then everything else that comes along with smart strategy and governance, right? Like risk tiered approval and monitoring over time as the AI is implemented, and then response protocols, right? All of that is in there. What do you think, Neil?
No, I completely agree. In fact, when we built our Gravity platform to really think through what would be the prerequisites for moving the needle, one of those was asset management. There's going to be lots and lots of different AI applications, AI bots, AI agents, co-pilots. How do you know who's who in the zoo? Who's able to use them? Who's able to configure them? That's one element of it. The second element of it is once you have these different assets, how do you make sure that you can meter them? It's quite possible that a rogue employee can gobble up half of all your computational costs and limits for that week or for that month. So that's an incredibly important part. And just dovetailing on your comments about the strategy, I would just caution after having seen many of these organizations that the governance process needs to be multidisciplinary. A strategy is not just coming out of the IT shop. It's not just coming out of the business areas. It is a multidisciplinary way to go from a existential threat to the business to a strategic imperative that needs to have everyone involved. There are some health plans that I've spoken to that are actually also incorporating the voice of the member. So they're bringing people in that are not part of the company and making sure that whatever they decide and design that might be member facing is being done in a way that's respectful to their relationship with their members. And so I think
I love that.
100% agree with you, Abdul. I think the strategy and the governance is critical, but the biggest mistake I've seen is when you make this into an IT transformation and not a overall enterprise transformation.
Mhm.
And I'll underscore your last point that, those organizations that are bringing in the member voice, the patient voice, that's not easy, right? And sometimes it's a check the box. We never want to see that, even if it's unintentional. And I appreciate that that's something we are starting to see because that's what's so important at the end of the day. Like, is this use of AI transparent, right? Is it meaningful and helpful?
Yeah. And I think just the reason why it's so critical is I don't think we can go for an entire week without seeing headlines around some of the pushback we're seeing on AI. Some of it is misunderstanding the role of AI and agentic workflows. Some of it is fear. And I think a good AI strategy for a health plan that is so public facing needs to be one in which there's an offensive and a defensive posture to the way we communicate that internally as well as externally about what it is that is being done with AI. So the other foundational capability I would say is a very good communications team.
So to dovetail a little bit on the governance side of things, so AI is becoming, we talked about this a little bit earlier, but more embedded in the clinical and operational decision making, right? And so when it comes to governance, trust, security, compliance, et cetera, those are becoming non-negotiable. So which you see are some of the most important on kind of the non-negotiable side of things?
Look,
EMS has put out their guidance, right? Which is pretty good. Like they have five things that they said we really need, and these are operational requirements, right? Not aspirational. Explainability, audit trails, human in the loop, PHI protection, bias monitoring, but each one of those you can unpack, right? And it touches on some of the issues we've been raising, including the importance of governance and having the right representation in those governance committees across the different business functions.
yeah, and keep in mind that what Abdul is sharing is exactly the way we need to be moving. But many of these NIST standards are voluntary in a sense. There's as I said earlier in the conversation, there are tailwinds from a regulatory point of view. But the NIST is a place that you start as the foundational level. It's the floor of good hygiene when it comes to AI partners. I think thinking through who are your partners are going to help you create that RFI, RFP, that checklist that the chief information security officer or that chief AI officer is going to want to know from AWS or want to know from Innovacer or any of your other partners. That piece of it is important. And again, NIST is a floor, a good floor, but thinking through what the future might be, there's going to be elements of responsible AI, and it's going to vary based on use case. Explainability is going to vary on use case, and so on and so on. So again, it's a great framework. Uh, The
It's
question
table stakes.
is table stakes exactly, and either you have the muscle to go build that capability in-house, or you find partners who understand this and help you get there.
So back to your guess, Anil, in terms of some of the survey questions around data, right? So obviously AI models are only as effective as the data that they can access. So, given how a lot of the payer environment is really fragmented when it comes to data across claims, clinical pharmacy, ops. Talk about how critical a unified data foundation is for AI in terms of just meaningful outcomes.
Well, I think there's two parts, right? It's the data, unified data that you need to have. But the way large language models operate, there also needs to be unified knowledge base. And maybe I might be overcomplicating things for our group, but think of LLMs, but also think of SLMs, small language models that are built very specifically for a singular task. Think about a prior authorization or a utilization management request. How do you read a policy document? How do you gather the clinical evidence? All that know-how needs to be packaged up, but it's one part of it is the data, the underlying discrete data about an individual member. The other part of it is what are the knowledge bases that we need to hit that large language model against or that small language model against? Because in the absence of a knowledge base, there is too much of a risk for making things up. Large language models and AI, generative AI, has a risk of hallucinating or confabulating, coming up with things that don't really make sense in the real world. Having that knowledge base uh, helps constrain what these large language models do. So it's not just the data, Derek, but it's also that knowledge base that grounds those large language models and small language models to a very specific purpose. And then it's all the validation that needs to happen after.
Yeah, I would underscore that, right? That a critical choice is around models and portability. But beyond that, like you want a platform that can help you access multiple models. And we have that mentioned here, right? OpenAI, Claude, there's others. Because model choice allows you to then think through what is the value you're getting from the model, the costs you're getting, what are the trade-offs? Because every model has trade-offs as well, right? And you want to be able to have flexibility to swap it in without re-architecting everything, right? That flexibility with a partner, I think like an Innovacer who brings your healthcare intelligence layer, that's a strategic asset, right? And that allows you as customers to be able to differentiate, right? Because you have your data, you have your governance approach, you have your member strategy. That's what differentiates you, right? And then partner on what accelerates you, right? The different types of AI and the AI strategy to implementation, the domain logic, right? Because the pace of innovation is moving so fast that what's, state of the art 6 months ago is like, hey, we better have that at the table right now, today.
And I think for all of you, it's going to be an existential threat if you build with a single LLM in mind and tomorrow that LLM turns out to vanish. And I love the fact that we put etc. on here because I don't know the names of the LLM that will be out a year from now. I don't. No one does. And these things move so quickly, to Abdul's point, that creating I won't say rip and replace for these large language models, but some sort of modularity where you can still have the best of both worlds is not only critical for the LLMs, but also for the SLMs and also for the RAGs or these knowledge bases that go along with it. Any of these things could be a single point of failure if you're not careful.
Great insights there. So let's jump to the last question. So, how will agentic AI redefine payer ops? Again, please participate on the survey. So everything we talked about so far has largely been, AI assisting humans, et cetera. And so, AI that surfaces a recommendation, automates a task, flags an issue. So what's coming next is really the next meaningful step in change. AI systems that can autonomously execute and really push forward multi-step workflows. So for health plans dealing with operational complexity and workforce pressures, this is obviously a big deal. So the primary question is, how do you see agentic AI reshaping payer ops over the next few years?
I think we've talked about this a little bit, and I can't wait to see what the audience says because we're seeing some threads, right, in the near term versus the mid range.
Exactly.
what I will tell you is that we always underestimate what can happen in 5 years and overestimate what can happen in 6 months. So whatever we come up with here, I'm sure we're going to have to take with a little bit of grain of salt here, but we'll see.
I like that tagline, Anil.
Yeah, a lot of
Um,
optimists on the call.
yes, look at that.
That's awesome.
And
Yeah,
incremental, right? So that's
yeah,
really what we've talked about, that there's some immediate near-term value. You can see ROI, and the major transformation is what we're going to be seeing, right? That we're going to be redesigning workflows with agentic AI, right? And so, I think we're seeing investment in like agent supervisors, right, who can manage these AI workflows and not just like executing discrete tasks, right? So that you can then redeploy your talent where you need it, like for more complex care management, right? And it's really meant to elevate the time and the bandwidth of your workflow.
yeah. And I would just look across your organizations and see where are you using AI to simply answer questions or to fetch information, and ask yourself, can you find use cases where you can actually have agentic AI do things, call patients, do that HRA, do do that call to let them know that they're eligible for a program instead of just identifying them and handing it off to another person. So I think there'll be major operational transformation, but keep in mind that all this needs to be dovetailed to the regulatory winds that are blowing. And as much advocacy as all of you might be able to do to help move the needle along, go for it. Because in the absence of people who are doing this every day, we tend to see regulatory changes that may not be aligned to the real world. It's happened more than a handful of times. And so I would say huge operational transformation as long as the regulatory changes are still tailwinds and not headwinds. We're seeing some inklings of consumer protections and all that are aligned to this, but then we're also seeing some challenges around workforce that could be a problem. So I think it's going to be a huge transformation. We just need to make sure it's dovetailing very closely with what we can and what we should do.
That's right. And then, Neil, you mentioned like a couple of examples were embedded in there of agents right now, right? Like an assembly agent that can bring together the right information for a case. And then there's like, it could be like a pattern agent, right? An agent that assesses and pre-processes the more straightforward cases, but then a supervisory agent that can escalate the ones that need more complex review so that that nurse that was reviewing 40 cases now only has to review 15 cases, right? But and it's kind of really looking at how that all aligns, as you said, with what's possible in terms of the regulatory landscape, in terms of the ability for you to then do organizational transformation and the governance and all the other pieces to make that work in your organization. And the harder
Yeah, and
part,
also
we know
keep.
it's not the
Go ahead.
barrier typically, right?
Yeah.
It is really org transformation, it's governance, it's trust with your people, with your members that matters.
And I would also add as a doc, I got to bring this up. Your members are patients for somebody else, and making sure that the the operational transformation that health plans do also sits well with the operational transformation that providers are doing with agentic AI. So the future might be that the providers are using agentic AI to help support their prior authorization process, and health plans are using it to support their utilization management process, and they need to communicate with each other. That orchestration, that inter-agent communication is the future, and we're seeing that already. Like I won't name the company, but I can use a company's AI agent to schedule a reservation for a restaurant and just say, I want an Italian restaurant in this city, and it will do it. There's multiple handoffs that are happening in that process. And between health plans and providers, maybe even the regulators and the consumers and the members and patients, there needs to be some level of orchestration. Otherwise, there's going to be an impedance mismatch, and that transformation may come to a screeching halt if we're not careful.
To add on to that first survey question or the first survey response, excuse me. So we really see agentic AI, primarily, reducing manual burden, maybe improving some workforce productivity. But I think that the main question is do you believe it'll eventually reshape, how payer orgs structure their teams or redesign their entire operational processes? So, what do you see in terms of, AI agents augmenting teams versus, fundamentally redesigning payer workflows?
Well, I'm on record of saying that digital transformation is not simply digitizing information. AI transformation is not simply putting a bunch of AI stuff everywhere. It needs to be one in which everything is inspected, disassembled, and then reassembled to optimize that. So yes, teams will change. Just as Abdul mentioned earlier, if you've got a digital coworker or an AI colleague, we have to think about what that means for the way the teams are structured, the way the teams are evaluated, the way teams are given their goals, etc. So I would hope that no one assumes that everything stays the same when it comes to team structure, and all of a sudden we're going to expect brilliance out of these AI transformations. It has to change.
That's right. And the way we're looking at it, for example, just even with the use of AI in our own workforce at AWS, is that, AI should elevate everyone's work, right? And their ability to do more valuable work. Because, show me one manager who's not going to tell you that they want more out of their team, right? That doesn't even exist. And so AI can give more bandwidth to your team if it's structured right, right? And that's where you have to really be thoughtful about the org change that and redesign that agentic AI in particular represents. And I think that's what's exciting, but it takes strong, commitment, leadership commitment. It takes, partners as well, like Innovaccer and AWS, to really help drive that change.
All right. Thank you very much for that. So, Anil or Abdul, anything there before we jump to the next section? All right. So
I would
let's,
just say
oh, go
that
ahead.
I'll just add one other thing. Just looking at headlines and looking at what's happening in other industries, transparency with employees is important. Training of employees on what does AI transformation look like and what is their role in that transformation is critical. Otherwise, again, uh, it could be a PR nightmare if folks are not careful.
Also look to, and I'm plus oneing what you just shared, Danielle, look to what different governance bodies, different professional societies are also sharing about training this next generation of the workforce, right? Because there's incredible disruption taking place in the workforce due to AI, but also incredible opportunities as well. And so, for example, I'm on an AI task force for schools and programs of health. It's a national task force. And we're thinking very thoughtfully about how do we really prepare this next generation of workforce. And I think any organization is going to do themselves a disservice if they also don't think thoughtfully about, how they're training their early career members in their organization, because those are the ones that are going to really be on the forefront of an organization's ability to get value from AI, right? Not the current staff. It's this next generation that are coming in. So I would urge you all as participants to really look at what's happening across the different professions in our industry.
Yeah, and again, 100% agree, Abdul. I'm on the board for Kent State University, their nursing informatics program, where nurses are learning a second career in some cases around health informatics. Anyone who's on this call who has not used a large language model like ChatGPT, OpenAI, Claude, before the end of the day, go out and use it. It is incredibly powerful, and it could also be a little scary. But before we can transform an industry, we need to transform ourselves in terms of how we think about these different capabilities. So it takes a very short amount of time to get familiar with some of these things, and then. My guess is that most of you have probably already tried it.
All right. So I don't see any questions coming in right now. So I'm going to tee one up here that I have in my back pocket. So For both of you, what's the biggest misconception you're seeing out there right now in terms of health plans that they have about AI? Right. So is the industry, are they overestimating what AI can do in the short term? Are they underestimating how transformational it can become in the longer term? What are your thoughts?
I mean, the one I still see quite frequently is that they treat AI as a clinical and operational discipline. Um, and many of their leaders are still thinking of it as a technology discipline. So sometimes it's misalignment on funding. Sometimes, if you look at the RFPs and RFIs, it's very tech focused and not business focused. And so the biggest misconception is that AI transformation should be a clinical and operational activity, not just a technology. Of course, technology is a part of it, but not just a technology one. And I think the second one that I'll just quickly throw in there is that it's not, the question can't be anymore about should they do something with AI. Now the question should be, what are we going to do with AI? And how fast can we do it safely?
Yeah. Yeah, I would agree. I would just say when I talk about, where the value of AI is really accelerating in our customers, our organizations, true AI enablement really is culture change, right? And we're talking about workforce and workflow redesign, right? And role transformation, right? And that is, as you said, Anil, this is not just technology, right? This is really changing the workforce if it's done right and to really take advantage of the value of AI.
Yeah. And when you do look for partners, whether it's Innovaccer or AWS, look for partners who have eaten their own cooking, if you will, because that transformation, it does require partners who understand and empathize with what that transformation really means.
Yeah, thank you very much. So I think we're just about out of time here. So appreciate the insights here. Anil, Abdul, fantastic, great conversation. I learned a lot personally. Hopefully the participants did as well. So thanks again for joining. But before we wrap, if you go back to the previous slide, there's a report available to download. It's called the AI Powered Payer. It goes a lot deeper on a lot of the stuff that we covered today. So definitely worth grabbing for a read on your next plane ride or whatever that might be. So. And then also, please take a couple minutes to fill out the feedback form. It really helps us shape future sessions to really get what you need out of these type of webinars. So thanks again, Abdul and Neil. Great conversation. And thanks to everyone for joining today.
Thank you,
Thank you,
Derek.
Derek, and a lot of
Really
fun
appreciate
talking to you, Abdul.
partnership and the findings in this report. They confirm what we're seeing across the industry, and so really, really excited to be part of this conversation.
All right. Thank you.